Hey everyone, Dr. Mike here. Today we're diving into three incredibly common conditions that I see all the time in my practice. Laryngitis, otitis media, rhinitis, you probably know them better as losing your voice, a painful ear infection, a persistently stuffy or runny nose. These aren't just minor annoyances, they're part of a closely connected system, the ENT system. Understanding how they work and how they affect each other helps you take control of your health. These issues can disrupt your sleep, your work, your overall quality of life. These conditions are especially important to understand for kids. Their immune systems are still developing. The anatomy of their eustachian tubes, the little passages to the middle ear, is different from an adult's. They're shorter and more horizontal. That makes them a prime pathway for infections to travel from a simple cold into a painful ear infection. This is why children get ear infections more often than adults. Knowing the signs and what to do can make a world of difference for a suffering child and a worried parent. Think of your ears, nose, and throat as a neighborhood of connected houses. A runny nose from rhinitis can spread to the ear, causing fluid buildup, otitis media. Postnasal drip can irritate the throat and voice box, laryngitis. This interconnectedness is why a simple cold can spiral into multiple issues. So, what exactly is laryngitis? Simply put, it's the inflammation of your larynx, which you probably know as your voice box. This structure in your throat houses your vocal cords. When you talk, air passes over them. They vibrate to create sound. But when your larynx gets inflamed, your vocal cords swell up. This swelling changes the way they vibrate, which is why your voice can become hoarse, raspy, weak, disappear altogether. It's your body's way of putting a do not disturb sign on your vocal cords, telling you they need a rest to heal. The most common culprit behind laryngitis is a viral infection, like the ones that cause the common cold or the flu. You get sick, and the virus irritates your throat and larynx. However, that's not the only cause. Straining your voice, think screaming at a concert, cheering at a football game, talking for too long as a teacher or presenter, can lead to acute laryngitis. Other irritants like cigarette smoke, excessive alcohol acid reflux, stomach acid coming up and irritating the throat, can also be major triggers. In these cases, it's not an infection but direct irritation causing the inflammation. The hallmark symptom is, of course, a change in your voice. It might sound gravelly weak or you might only be able to whisper, but that's not all. You might also feel a tickling sensation in your throat, rawness in your throat, a persistent dry cough, the constant need to clear your throat. Some people experience a sore throat, though it's often more of an irritation than the sharp pain you'd get with strep throat. If a virus is the cause, you'll likely have other cold or flu symptoms too. Let's talk about otitis media, the medical term for a middle ear infection. This is an infection or inflammation of the space right behind your eardrum. This area is normally filled with air, but when it gets inflamed, fluid can get trapped there. This trapped fluid can then become a breeding ground, bacteria viruses leading to a painful infection. It's one of the most common reasons parents bring their children to the doctor. The pressure and pain from that fluid buildup can be intense, especially for little ones who can't tell you exactly what's wrong. There are a few different types. The most common is acute otitis media, or AOM. AOM often comes on suddenly, marked by swelling, redness, and trapped fluid in the middle ear causing pain and sometimes a fever. Then there's otitis media with effusion, or OME. Fluid remains trapped behind the eardrum after an infection has cleared, with no active infection. It might not be painful, but it can cause hearing problems. If these episodes keep happening, it's called chronic otitis media. Chronic cases can lead to more serious long-term damage to the ear. In kids, the signs can be tricky. They might pull or tug at their ear, be unusually fussy or irritable, have trouble sleeping, or have a fever. They might also have difficulty hearing. You may notice they don't respond to quiet sounds. In older children and adults, symptoms are usually more straightforward. A sharp earache, a feeling of fullness or pressure in the ear, muffled hearing, and sometimes drainage from the ear canal. Dizziness or loss of balance can also occur, since the inner ear plays a key role in our equilibrium. Now let's tackle rhinitis, which is essentially inflammation of the mucous membrane inside your nose. When this lining gets irritated, it triggers a chain reaction. Your body produces a ton of mucus, your nasal tissues swell up, and you're left with that all too familiar stuffy, runny nose. While many people think of rhinitis as just allergies, it's actually a broader category with different causes. Understanding which type you have is the key to finding the right relief, because the treatment for one might not work for the other. It's about targeting the specific trigger that's making your nose so unhappy. The most well-known type is allergic rhinitis, or hay fever. This happens when your immune system overreacts to a harmless substance called an allergen, pollen from trees, grass pollen dust mites, pet dander mold. Your body mistakenly sees these particles as a threat and releases histamine, a chemical that causes all those classic allergy symptoms. It's your body's defense system going into overdrive against an imaginary enemy, leaving you miserable in the process. Then there's non-allergic rhinitis. Perfume cleaning products, changes in the weather or temperature, certain foods, certain drinks, smoke, some medications. In this case, the nasal tissues are hypersensitive, but it's not an immune system response involving histamine in the same way. This is why standard antihistamines often don't work well for non-allergic rhinitis, which can be frustrating for people who assume they just have bad allergies. The symptoms for both types are very similar, which can make it hard to tell them apart without a doctor's help. However, allergic rhinitis often comes with itchy eyes, itchy nose, itchy throat. Non-allergic rhinitis typically doesn't cause that itchiness. It's so important to understand that your ears, nose, throat don't operate in isolation. They're actually part of a single, continuous system lined with similar mucous membranes. A problem in one area can easily create a domino effect. Think of rhinitis, that inflamed, runny nose. All that excess mucus has to go somewhere. It can drip down the back of your throat, a process called post-nasal drip. This constant dripping can irritate your larynx and vocal cords, leading directly to the hoarseness and throat clearing of laryngitis. Your stuffy nose just gave you a sore throat and a lost voice. The connection between the nose and the ears is just as direct, especially in children. The eustachian tube is a small canal connects your middle ear to the back of your nose and throat, the nasopharynx. Its job is to equalize pressure and drain fluid from the middle ear. When you have rhinitis, allergic, non-allergic, the inflammation and swelling can block the opening of this tube. When the tube is blocked, fluid can't drain from the ear. This creates a stagnant, fluid-filled environment behind the eardrum, the perfect breeding ground for bacteria, causing a painful case of otitis media. This is why managing allergies is so critical for people with recurrent ear infections. If chronic allergic rhinitis is causing constant nasal inflammation, the eustachian tube may be persistently blocked, leading to chronic otitis media with effusion, fluid in the ear. This can cause long-term hearing issues and repeated infections. By treating the root cause, the allergies, with antihistamines, nasal steroid sprays, allergy shots, we can reduce the nasal inflammation, allow the eustachian tube to open up and function properly, and break the cycle of ear infections. It's a perfect example of proactive systemic treatment. So, when you come to a doctor with one of these issues, we're trained to think about the whole system. When you come in with symptoms, the first and most important step for me is to listen to your story. Your medical history tells me so much. When did the symptoms start? Are they constant or do they come and go? Is there a fever? Do you have a history of allergies? Have you been around anyone who is sick? For laryngitis, I'll ask about your voice use. Have you been yelling or talking more than usual? This conversation helps me narrow down the possibilities before I even begin the physical exam. It's the foundation upon which a good diagnosis is built. Next comes the physical exam. For suspected laryngitis, I'll look at your throat for redness and signs of irritation. An ENT might use a small mirror to get a direct look at the larynx, or a flexible scope called a laryngoscope. This lets them see if the vocal cords are swollen, or red, or have any growths on them. For otitis media, I use an otoscope to look inside your ear. I'm checking the eardrum for redness, for bulging, or fluid behind it. A healthy eardrum is translucent and grayish pink. An infected one is often fiery red and pushing outward from the pressure. For rhinitis, the diagnosis often involves figuring out if it's allergic or non-allergic. To confirm, we might recommend allergy testing. A skin prick test is very common. A tiny amount of different allergens is pricked into your skin to see if you have a reaction. A small, itchy hive is a typical reaction. A blood test can also be done to measure levels of specific antibodies, IgE. In some cases, we might need more advanced tools. The treatment for laryngitis is usually straightforward, especially when it's caused by a virus. Vocal rest, and I mean true rest. No talking, no whispering. Let your vocal cords heal. Stay hydrated. Drink plenty of water. Use a humidifier to keep the air moist, which soothes your throat. If acid reflux is the culprit, manage with antacids, other medications, and dietary changes. For severe inflammation, a doctor might prescribe a short course of corticosteroids, usually reserved for people who need their voice for their profession, singers, public speakers. When it comes to otitis media, Treatment depends on the cause and severity. Many ear infections are viral and can resolve on their own. We often recommend a watch-and-wait approach for 48-72 hours, especially in older children. Manage pain with over-the-counter relievers, acetaminophen, ibuprofen. If the infection is clearly bacterial, severe, or doesn't improve, antibiotics are the go-to treatment. Complete the full course of antibiotics, even if symptoms improve. For allergic rhinitis, treatment is multifaceted. First step, avoidance. Limit exposure to known allergens. If that's not possible, medications help. Antihistamines block the histamine that causes symptoms. Antihistamine pill form, antihistamine nasal spray form. Nasal corticosteroid spray is often the most effective long-term treatment. For non-allergic rhinitis, steroid sprays help. Saline nasal sprays rinse out irritants. Decongestants provide short-term relief. Don't use more than a few days. For persistent or severe cases, other options exist. Children with recurrent chronic ear infections or persistent fluid causing hearing loss may get tympanostomy, ear tubes. For severe allergies not helped by meds, immunotherapy can help. Allergy shots under the tongue tablets. Immunotherapy gradually desensitizes your immune system, giving long-term relief. So, we've covered a lot of ground today: the raspy voice of laryngitis, the sharp pain of an ear infection, the endless sniffles of rhinitis. These three conditions are often linked. A problem in your nose can lead to issues in your ears and throat. Recognizing this connection is the first step to better management. Treat them as an interconnected system, not separate illnesses. Remember the key signs and when to seek help. Laryngitis. Hoarseness lasting more than 2 weeks. See a doctor. Otitis media. Severe pain, high fever, fluid draining from the ear. Seek medical evaluation. Rhinitis. OTC meds not working and daily life impacted. Get a proper diagnosis. You don't have to just live with it. Early and accurate diagnosis is your best friend. Empower yourself with simple home care. Rest, stay hydrated, use a humidifier. For pain, acetaminophen, ibuprofen when used as directed. For nasal congestion, saline nasal spray to flush irritants without decongestant side effects. These tools can greatly improve your comfort during recovery. Ultimately, you are the CEO of your health. Understand causes. Recognize symptoms, know treatment and prevention options. Have open, informed conversations with your doctor. Ask questions. Work together on a plan that targets root causes, not just symptoms. Manage allergies to prevent ear infections. Rest your voice to heal laryngitis. Stay safe and be well.